Kleber. I'm here to talk to you about obesity and heart disease. In one article I looked up, which looked at obesity within men, there were 792 overweight men who took part in this study. It was an 8-year follow-up, so following 8 years of the initial evaluation, none of the people who took place in this study had any risk factors relating to any cardiovascular disease or issues initially. But following the 8-year follow-up, of the 792 men that were participating, there were 33 cases of stroke, 91 cases of heart disease, and there were 109 deaths that occurred that had to do with some kind of cardiovascular issue, whether it be due to stroke, the heart disease, heart attack, any of those, showing a correlation between obesity and cardiovascular issues. So the etiology has to do with heart disease, has a lot to do with coronary arteries of the heart. This is a disease that begins at childhood, something that can be avoided at childhood, but where the childhood is how you eat, whether or not you exercise properly, stuff like that. Within the coronary arteries of the heart, they become damaged, and throughout the years of somebody either eating poorly, not exercising enough, plaque builds up. And the more plaque that builds up, the more issues that can occur. It can become unstable. If it becomes unstable, it breaks off and leads to a lot of issues such as stroke, heart attacks, stuff like that. So again, this is something that begins from childhood and something that is preventative with proper nutrition. So diagnosis. Angina is any pain within the chest area caused by this plaque. Unstable angina is when these plaques become loose, cause a lot of pain from the chest, the arm. An increased heartbeat usually is associated with obesity as well. This is just extra strain in the heart having to pump blood throughout the body. Normal heartbeat should be roughly 70 beats per minute in a healthy adult. Anything above 90, closer to 100, that usually is way too high for a healthy individual. Increased blood pressure is another sign of cardiovascular disease and obesity. A systolic blood pressure of 120 and a diastolic pressure of 80 is usually healthy. If it becomes above 140, the systolic blood pressure, and above 90, the diastolic, that is hypertensive blood pressure, in which case that is dangerous and become an issue. Smoking is a big issue. Smoking just in general is unhealthy, but it can increase your heart blood pressure and cause other health issues. High body mass index, so BMI, those is not always indicative of obesity. Generally, people who are overly obese tend to have high BMIs, which can become an issue for strain in the heart. Decreased high-density lipoproteins and an increase in low-density lipoproteins is generally an issue. This is good for bad cholesterol. High levels of bad cholesterol can become problems for the heart. Family history, so anyone in your family who has a history of cardiovascular disease, died of cardiovascular disease, anything like that, that are going to put you at a risk for these issues. Any history of obesity in the family puts you at risk for these issues. So that's something that you want to take a look at when considering your health status. Diabetes is another issue that has to do with cardiovascular disease, and like the main topic we're talking about is obesity, whereas obesity does have a correlation with some heart disease, as I'll show you in other studies later on in the presentation. So treatment and intervention. As I said previously in my presentation, this is something that can start at a young age. So this is something that can be easily preventable with a healthy lifestyle, good exercise, proper nutrition habits, good diet, and proper maintain of your weight. For those who are obese as adults, improving your health, improving nutrition, improving your physical activity, and doing more, trying to lose that weight, that is a big way of helping to prevent or treat cardiovascular disease. As you'll see in an article I'll go over later in the presentation, you'll see that increase in obesity as an adult actually has a higher correlation with cardiovascular disease as that if you just maintain it since you were a kid. And surgical, they can do a balloon, which is a picture up to the right, where they surgically place this balloon into your coronary arteries and they expand it. And this expansion presses the plaque up against the artery walls and helps open up the arteries a little bit for better blood flow. They can also put in a permanent stent, which will help in a very similar manner, try to press that plaque up against the artery walls. So the first article I took a look at was an article that took a look at childhood obesity and then did a 17-year follow-up to see where these people were 17 years following this. There were 2,617 participants that took place in this study. I said it was a mean follow-up of 17 years. Of the 2,617 people, 77% of them remained obese following the 7-year follow-up. And they also had an increase in risk factors. A lot of the people at the beginning of the study, for 17 years they took a look at, they did not have any real risk factors other than obesity for cardiovascular disease. But as they aged, they developed more risk factors due to the obesity, putting them more at risk for cardiovascular disease. They did find a relation between childhood obesity and heart disease, showing that a lot of the younger people who were obese, as they got older, they tend to suffer from cardiovascular disease or some kind of cardiovascular issue. They did also find that there was an increase in people who, when they might not have been as obese as a child, but they gained more weight as an adult, so following not necessarily from when they were young kids to a teenager, but when they were a teenager to a 37-year-old, and they had an increase in obesity, they actually had an increase in cardiovascular issues. The second study we looked at was obesity and heart disease in women themselves. There's a cohort study of 100,015,886 women. There's an 8-year follow-up. Again, most of these women were not showing as many risk factors other than the obesity for cardiovascular disease. But following the follow-up, there were 605 coronary incidents that were their first time suffering from any kind of cardiovascular issues, such as coronary artery disease. 70% of the heart disease was obesity related, so there was a direct correlation in the fact that people were overweight, they were obese, and that they were suffering from some form of cardiovascular issue. Again, like I said, in the last study, similarly, with an increase in weight gain as an adult, there was actually an increase in cardiovascular issues. They found that a lot of women who were suffering cardiovascular issues had a lot stronger weight gain as an adult rather than a younger person. And they found that there were a lot of cardiovascular issues, not just with the extremely overweight women, but even the moderately obese women, that there were still cardiovascular issues. And that it wasn't just the overweight women so much, but even someone who is moderately overweight, that doesn't have much greater risk of cardiovascular disease than if you're just trying to live a healthier lifestyle. And these are my references, and thank you for your time.